Okay. I'm taking that as a resounding yay! So what we'll do now is I'm going to move the camera over. I'm going to review the landmarking in the skull here. Okay, you fabulous people. This is a replica of a human skull, and it's a pretty darn good one. So the kinds of, what I'd like to review is, I'll do the whole thing in terms of how we palpate everything, but I'll put a little bit more emphasis on the pterygoids, the medial and lateral pterygoids. So the way I run this protocol myself is when I'm treating the right side of the person's body, then I have a glove on my right hand. And the first muscle I like to treat is the masseter. So the masseter, you don't have to go between the person's teeth. So, unless they have got, some kind of a really, really strong reactive system, it's not going to be choky or gaggy because you've got this partition here between your finger and the tongue and all that stuff. So I just follow along, the lower of the uppers. I run into the margin of the masseter here coming off the zygomatic arch, and it swings down onto the mandible here. Sometimes I'm wondering, like, what the heck? I really can't even feel it. If someone's got really low tone in their masseter, then sometimes it's almost invisible. So if I ask them to clench their teeth, bong, it pumps up like Arnie back in the day. So I get them to clench. I can feel the border of the muscle. Then as they relax their jaw, then I follow the muscle into its more relaxed, kind of sweet hammock-like state. So basically that's the contact for the masseter muscle. After treating the masseter, and I'm not going to go into all the specifics. Let's just do the landmarking thing, okay? So then for the temporalis, I follow the lower teeth here until I run in to the sweet edge of the sort of the bottom of the coronoid. So I run into that, and I have to go medial. I have to go on the inside of that and then swing up the inside of the coronoid. And then there's that whole thing about homologous fibers, so that high tone, tension, and tenderness here is going to be express itself as high tone and trigger points and knots and anterior fibers of the temporalis. And as I scan further up and posterior on the coronoid, then I scan, further back upon the temporalis. So those are my contact positions there. Now, let's look at the lateral pterygoid next. This is the lateral pterygoid plate right here. Could you hand me a pen? Thanks, Jess. Anyone will do. Thank you. So this is the lateral pterygoid plate here, and the lower part here, these are the fibers that are going to swing back, and they're going to hang on to the neck of the mandible. So what do I do for that? I don't sit on the table, but I climb along the upper teeth here, and maybe we'll just take the jaw off for a second. We'll swing it out. I don't do that. That's a contraindicated move. No. Just to state the obvious. So as I come along the back here, there's a certain feel, You can feel somebody's teeth, and you can feel the gum line. It's got a certain quality. As you go back here, if they've got all their dentition, you're going to find that the maxilla sort of falls away, and then you run into another gum line, but there's no tooth there. That thing that feels like the gum line is the connective tissue over the lateral pterygoid muscle. So I'm climbing along here. I may bang into the coronoid process, so then I shift them a little bit. I just get them to shift their teeth a little bit, and then I've got tons of space in here, and I can go further back. Okay, so I'm right on this little part here. Now, the way I confirm that it's actually muscle is I hold on to the front of the person's jaw, and I just gently, if the jaw is hanging like this, I gently push it back. See, it's only, you know what, my fine friends? I'm going to mute you all for a minute. so that there's less background noise. I think I'm muting you all. Oh well. Oh, you're all muted. Fabulous. Okay, so here we are. I'm going along to the back there, and when I feel like I'm on that gum line, to make sure that I'm on the inferior head of the lateral pterygoid, I just push the mandible back, and it's only about 2 millimeters. But when I do that, I can feel the tone changing underneath my finger pad. If I'm a little bit proximal, like I'm more anterior, it's like I don't feel anything. So I know when I get onto the stuff that feels like gum line, and if it changes when I shift the mandible back, Bob's my uncle. Okay, so that's how I confirm that. Then the superior head of the lateral pterygoid comes off the lateral pterygoid plate, but it's more superior. And it's a very similar process. Sorry, I'm new with this skull here. Which way is the jaw going? It's very embarrassing when the teacher doesn't know, which way jaws go. Okay, so where am I here? So to go to the superior head, I come in here, but I try to go up. Sometimes you can just go straight up. Sometimes I have to turn my finger and kind of hook it, and then I flex my dip, my distal interphalangeal joint. When I do that, then I feel some tissue that, again, it feels like gum line. It often feels meatier because there tends to be a little bit more mass there. And then when I push the mandible back, I should not feel a connection to my finger. So that's how I distinguish the boundary between the inferior head and the superior head, is that I'm feeling the connection with the mandible, and then I'm a little bit higher. It's like, oh, I've lost it. So at that point when I've lost it, in a spirit of scientific inquiry and clinical intrigue, I feel the margin of the joint capsule here. And I hold on to the tissue of the ligament there. I just sink into it, a nice relaxed way. That really, I mean, they're not jammed up like this, eh? The mandible's about like that. So I sink into that space, and by virtue of the attachment of the disc to the lateral ligament there, when I pull on the capsule, then I feel it on this guy who's up in here on the superior head of the lateral pterygoid. So that's what's going on with that stuff. Then the medial pterygoid. The medial pterygoid comes off this. This is the medial pterygoid plate and this whole space in here. So it's the medial pterygoid plate and the gap between the medial and lateral pterygoid plate. So all that, the meat comes off of that, and then it comes down, attaches all along the margin of the mandible here. So it's really part of a hammock system between your masseter here and your medial pterygoid here. So it's just like the serrato rhomboidus myofascial sling. The edge of your scapula is just hanging out in the middle of this raft of myofascia. So to treat this item, this is the gaggy one, and I highly recommend you treat people's tongues first to help them relax. But for that one, basically, I like to go along the uppers here, and you can see on the, I don't know if you can see, it's the medial pterygoid plate, and this little projection here is the pterygoid hamulus. You don't break that. That would be bad, very bad. So you go in, and people start to get choky. If they're choky types, and they're not choky right away, as you get about 1/4 inch away from the hamulus, then they tend to start to feel kind of reactive and choky. What do you do about that? Well, you can treat the tongue. You can ask them to push their tongue over the other side, or you can respect their process and just do a fabulous job on their masseter, temporalis, and lateral pterygoids for 2 or 3 treatments, and then people are often less reactive as well. This is the one where you go back here, and it's very helpful, to have a sense of what you're following. The teeth there, the end of the teeth, you're on the hard palate. pterygoid hamulus. And then from there, you have to go, if you're Canadian or British, it's about 2 or 3 millimeters further back, maybe like an eighth to a quarter of an inch. And at that point, then you flex. Sorry, the computer's timing out there. You flex the distal interphalangeal joint. And that's how you get your way around there. Actually, I think I'm going to ask people if they have specific questions. And we've got about 5 or 10 minutes with Janice here. So